Today's session of our Vaccines Inside Flexible Learning course is about how do we publish responsibly. If you haven't tuned in before to any of the sessions, don't worry, these are meant to be standalone. And today's session is kind of self-contained, but you can also go and watch back all of our previous sessions on our Vaccine Insights Hub if you want to see how we got here. We've learned how to identify misinformation around vaccines. We've learned how to verify it. Today's session is all about what to do once we've got it. How do we discuss and talk about mis and disinformation without amplifying falsehoods, without making things worse? Basically, how do we do our work in a way that is responsible and that helps to create a positive information environment rather than polluting it more? My name is Laura Garcia. In case you don't know me already, I am the training and support manager at First Draft, and you can find me on Twitter at LauraGRB. If you don't know who we are at First Draft, we're a nonprofit that does research, monitoring, and training on how to face up to the challenge of mis and disinformation. We work with communities of journalists, NGO, health workers, communicators, teachers, librarians to try and build resilience against false and potentially harmful information all over the world. On the agenda today, we've got three things. We're going to talk about a phenomenon called weaponizing headlines and why then it's so important to pay attention to the words that we use as headlines. The second is how do we process misinformation and the research behind it that kind of gives some recommendations, right? And that's the third thing we're going to do. We'll go through the research first that backs up why the recommendations are what they should be and how we have seen this research change. We have to remember that the space of mis and disinformation as we see it now online as part of our information environment is a really new discipline. So the research and our understanding of it is always changing. So we're going to walk you through some of those changes and what the current best practices are. Let's talk about weaponizing headlines, which is the first one. And when I mean headlines, I hope that we think about this in a really broad sense. So it's anything that is the title of any kind of content that you produce online, right? This might be a news story. This can be the title of a YouTube video. This can be the first couple of lines in an Instagram post, because that's what people see when they scroll past, right? We're talking about the smallest bit of content around whatever it is that you're creating, but that tends to get the most exposure. And this is a story from the United States, from NPR, National Public Radio, showing that the stories that have gotten most traffic in the last year are those that connect vaccines and death. Some of them have been exactly this. They get most engagement because the fear mongering, playing on our fears, makes them go viral, right? We share things when we want to tell other people things to look out for. We share things when we want to make sure our loved ones are protected. Fear is an incredibly powerful motivator. And their research has kind of found that exactly that stories, even though they might not be well documented or they might not have a lot of facts, but that play on that fear spread like wildfire because people spread them, right? We have to remember that we have an intensely emotional and personal relationship with the information that we share with each other, that we share online publicly, that we use almost as a performance of our digital identity and the communities that we belong to. And vaccine misinformation particularly plays on that phenomenon. So here's an example of one of like a particular story. This is one of the web's most popular articles that creates or links vaccines and death, right? Here's a headline. A healthy doctor died 2 weeks after getting a COVID-19 vaccine. CDC is investigating why. The CDC is the Center for Disease Control in the United States. They are the ones responsible for kind of monitoring the implementation of new vaccines and medicines and anything medical, right? Look at how many words we're using there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 words to make a point. 15 words that people will scroll past really quickly on a screen. It's a very small amount of space to convey an entire story, right? And if you only read the headline, which a lot of us do when we're scrolling past things on social media, the story that you get from this headline is that a doctor who was otherwise healthy died because of the vaccine, right? It makes that link, even though it doesn't do it directly, it implies the link. However, if we click through the story, these are the first two paragraphs of the story. Look at the bits that have been highlighting. 2 weeks after getting a first dose of a Pfizer vaccine, a 56-year-old doctor in South Florida died in January, possibly the nation's first death linked to vaccine. That is a claim, right? Second paragraph. Health officials from Florida and the Centers for Disease Control and Prevention are investigating what role, if any, the vaccine played in the death of Dr. Gregory Michael, who is a Miami-based obstetrician who his family says was in otherwise good health. Look at the claim in the first paragraph and the claim in the second paragraph. The claim in the first paragraph is already going straight to making that link. It's possibly the first death linked to the vaccine, the Pfizer vaccine in the United States. And then the second paragraph goes on to say, we actually have absolutely no idea whether there's a link or not. But that claim is reinforced in the headline, it's reinforced in the first paragraph, and it misrepresents the story, right? Is there a possibility? Yes. Has that link been proved? No. But implying the link plays on people's fears, because obviously we all want to be safe, we want to keep our family safe, and we want to keep our community safe. And fear as a powerful motivator for mis and disinformation, particularly around vaccines, is something that we really need to keep in mind, particularly when it comes to headlines or top lines or titles, those little extracts of content that are sometimes the only thing we see before we decide to share something, but with really little evidence sometimes, right? So this is an update to the story that we were just looking at. It says 2 weeks after getting a COVID-19 vaccine, a Miami doctor died from a condition that causes internal bleeding. Although it developed suddenly, a medical examiner's report said that there isn't enough evidence to rule out or confirm the vaccine was a contributing factor. So even after their investigation, they don't know if there is a direct link, right? And even though 56 is pretty young, there could have been many other reasons why people suddenly develop kind of chronic conditions and sadly pass away, right? We have to remember that life doesn't stop just because vaccines are being administered, and people will have had health problems regardless of that vaccine or not. But if we don't keep making that link constantly, we're almost wasting an opportunity as communicators, whether you're a journalist or an NGO worker or a community organizer, we're wasting that opportunity to build trust, right? By reinforcing an implied claim that plays on people's fears. The other reason why headlines or top lines or titles are so important is because they can also be screenshotted and used out of context. This is an example that we got from our colleagues in the APAC office, and it's from a news outlet called 9 News. You can see the headline there. And the headline says, Sydney hotel quarantine worker tests positive to COVID-19 after receiving the vaccine. And that is a screenshot that's being shared in an account. If you can see it on the right, the account says Reignite Democracy Australia. And it links to the story. So if you wanted to go and read it, you can. But because of the nature of how Instagram displays text, you can't actually click it, right? You would have to actually put in a lot of effort to copy that link, play around with it so it selects the right bits, put it into a browser on your phone, because we need to assume most of times people are going to interact with this kind of content on their mobile phones, and then open it and going to read the story, right? That is 5 steps too many. Super easy to scroll past Instagram and just read the screenshot of this headline, absorb the implication that the headline makes, and keep that to reinforce any fears that we already have, right? When if you go and read the actual story, it says it's unclear, right? The fact is that someone who works in a quarantine hotel did get the vaccine and then tested positive, but that can happen. Depends at what stage of the vaccine, and different vaccines have different percentages of protection. But all of that context is lost when all you see on Instagram is a screenshot of a headline supported by the authority that we give institutions like the media, like governments, like NGOs, because you can see the logo. So the thought is, well, if they're saying it, it must be true, right? And that headline becomes weaponized as a way to chip away at public trust. So we have to keep that in mind when we're writing titles, when we're writing headlines, when we're writing the top lines of all of our content online and on social media, knowing that this is something that happens and that could happen to the headlines that we write. And it's sometimes the only time we're going to get to connect with people, right? Small space. We have 3 seconds to get someone's attention while they're scrolling past Twitter. And that is an important part of the process to keep in mind. And we have only a few moments to get it right. Our information, whether you're a journalist or a health communicator or someone working with a government, is competing with the entire contents of the internet. All of the cat gifs and the TikToks of the world, and also all of the disinformation that is trying to play on people's fears, right? So we have only moments to get it right. That headline, that title is where we need to always think about and take it with extra responsibility to make sure that we don't reinforce or accidentally amplify falsehoods, or even give kind of like a present to those bad actors who would want to screenshot and weaponize a headline. So let's look at the research about how we process misinformation and how it's changed a little bit. So when we started to do teaching around this space, we have always heavily relied on the work of John Cook and Stephen Lewandowski, who are incredibly smart people who wrote a book called the Debunking Handbook. And the first edition of the Debunking Handbook focused really strongly on something we call the backfire effect, which is that how you debunk might actually become a problem by either reinforcing things or attacking someone's worldview or making things super complicated, right? The main 3 ones were those: familiarity, backfire effect. If we keep repeating something, it's easier to remember. Worldview backfire effect is that if we frame debunks in a way that almost challenges someone's view, they're just going to reject them full stop. And overkill backfire effect, when we try and include all the nuance in a headline or a debunk, then because it's super complicated, people just don't engage with it and leave it behind. And what we were trying to do at this initial stage was weigh what is the risk of the backfire effect and what is the risk of not debunking, right? And how do you handle that delicate balance? But recent research has kind of shown that we may not have to worry so much about that effect, right? So this is, I mean, we say recent, it's from 2017, and there's more coming up. And you remember that academia sometimes moves a little bit slower than the rest of the world. But that backfire effect, that fear of not wanting to debunk because our debunks could reinforce ideas, hasn't actually been, we can't prove that link, right? And on the contrary, constant interventions to correct information have been found to have a positive effect. One thing we know for certain, regardless of the backfire effect or not, is that correcting belief and changing behavior are 2 different things, right? And one doesn't necessarily lead to the other. But in the end, that's what we're trying to do, right? We're trying to correct information with the hopes that people will take different actions based on that correction. And there's a really cool report looking at health misinformation in Africa, Latin America, and the UK. That was a collaboration between Africa Chequeado in Latin America and Full Fact in the UK. That is also available in Spanish, I think, online. That was updated last summer to kind of include coronavirus. That proves that, right? That us correcting information, if we're not thinking about how to link it to action or how to follow through, then sometimes doesn't have that desired effect. And think about something that's happened in your life, for example, as an example of what we call the continued influence effect. That means that even though you know that something isn't true, or that the information that you believe in is incorrect, that doesn't necessarily lead to you changing behavior, right? So this is an example. You find out that your mom got food poisoning from a restaurant. She went to eat to this restaurant and then spent the whole afternoon feeling really sick and throwing up. Later, you find out that that isn't true. Your mom had just had a really bad migraine and that's what made her throw up. The food had nothing to do with it. Nevertheless, you find yourself not going to that restaurant. You just avoid it. right? Because misinformation is sticky, or information in general is sticky, particularly information with high emotional impact. For you, the idea of thinking of your mom feeling really ill and really sick and throwing up is the most powerful motivator. It doesn't matter whether there was actually a link to that restaurant or not. And we have to keep that in mind when we're thinking about mis and disinformation of any kind. The continued influence effect, that a change in knowledge doesn't necessarily need to a change in behavior. So taking that on board and realizing that maybe we have to be less afraid of debunking and more thoughtful in how we do it, here are some recommendations. First one, focus on the facts, lead with the truth, and warn readers before you repeat any falsehoods, especially if we're talking about headlines and titles. Remember, we only have a couple of seconds to get that right, to get people's attention and to tell them what we know rather than what we don't know, right? Or ask a question that is confusing, or ask a question that implies something that your story or your post would actually disprove. Don't forget, you might have just those few moments to make that point. This is an example on the right-hand side of a story from very early on in the pandemic last year from an outlet called Medical News Today. And what they were trying to do was to dispel some of the main myths around coronavirus. But if you scan it, think about how you would interact with the story if someone forwarded to you on WhatsApp or Facebook Messenger. You're looking at it on a really small screen and you're doing this, right? Where is your eye going to linger? Probably on the font that is a little bit bigger and bold. And those in bold are the myths rather than the facts. So, for example, number 1 says spraying chlorine or alcohol on skin kills viruses. Only older adults and young people are at risk. Children cannot catch COVID-19. And that is a wasted opportunity in a really well-intentioned article, because what they were trying to do is give you information that fights those myths, but what they're highlighting is the myth, right? We have to remember that information also has a visual appeal to it, and how we organize things on pages and how we prioritize the information is also really, really important. It doesn't mean that you can't repeat the myth to make sure people know what you're talking about, but always lead with the facts, right? Number 2, provide an explanation. Avoiding simple retractions is really important. So a simple retraction is when you just say, oh, this isn't true, but you don't explain why. Because that means you're leaving a causal gap, right? We're all curious people. So the first question is going to be, okay, if that isn't true, why isn't it? And if you don't have an answer for that, it creates a little vacuum that then we fill in with whatever we get. So always provide an alternative explanation. How do you know something isn't true? Why is it misleading? Why is it not correct? And here's 2 examples, one from Australia and one from the States. For example, on the left, we have the Australian Competition and Consumer Commission with a list of scams around COVID-19 and phishing examples. So there's a very clear explanation to why things are false, because people are trying to scam you to get your money, to get your personal information, or like your bank details or anything like that, right? That answers that question. On the right-hand side, this is from Anchorage Daily News in Alaska in the States. And it says, a major funder of anti-vaccine movement makes millions selling natural health products. So why would someone want to sell you a cure that hasn't been approved and that isn't, there is no evidence that it actually helps to fight coronavirus, and that kind of helps you counteract the effects of the vaccine? Because they're making money, because they're profiting. That answers a question, right? And sometimes the explanation is really simple, like they're making money. Sometimes it's a little bit more complex and we don't know the intent of the person creating the information, but we can explain why the information is false or misleading or why it's framed differently. But filling that gap with an explanation is really important. The third one, keep it simple, but not too simple. So detail is important to earn trust, but too much nuance can be super overwhelming, right? A statement that has caveat upon caveat upon caveat makes it really hard to actually figure out what we were trying to say. And being simple and direct with our language and our communications is sometimes the hardest thing to do, right? But we have to remember that we have an entire arsenal at our disposal. We're talking about words, we're talking about visuals, we're talking about images. All of these different ways of communicating count into how we can keep our message simple, but include detail enough so that people understand how we got to a conclusion. We have to remember that sometimes misinformation and disinformation appeals to really rational people or really logical brains because it details step by step how they get to a conclusion, even if those steps are based on unverified information and even if the ultimate conclusion is false. But showing the process makes people feel like they're reading something that's really well researched, right? We kind of have to use that same tool or that same weapon to spread information that is verified. And visuals can be a really powerful way to do this. So this is, for example, a visualization that we found again early last year of the benefits, or to show you why staying home and socially distanced really helps to curb the spread of the virus. Because exponential growth is actually kind of hard to visualize in your head if you don't have a reference point for it, right? Thinking about your own role in the spread of a virus that then goes exponential is kind of really hard, especially since this particular virus has a 2-week incubation point, right? So you don't even see the effects immediately. But this visual is showing you how the one person at the beginning, not like working from home instead of in an office, actually stops the whole branch from growing. Or the person in the middle, not going to a barbecue, stops the second branch in the middle from spreading, right? That really clearly puts it into perspective. But you can see that it's a complex graphic, right? So detail is important, but our messaging has to be clear and direct, which isn't always easy, particularly when we're doing health communication. And it's important as well to understand the root concern of conspiracy theories in order to build trust, right? When we use words like dumb or absurd or insane or bizarre to talk about people who believe in different theories that we know are not correct, all we're doing is attacking for them. Think about them, put yourself in their shoes. That just looks like an attack into the things that you believe in for one reason or another, that you share with your community, that is part of your identity. Headlines like this are never going to change your mind, right? So we have to try and think also, what is the root concern? And sometimes there are really legitimate concerns that are either historical or personal to that community, right? So we know that, for example, communities of color across the world have historical, legitimate reasons to be a little bit wary of health institutions. Or, for example, women who have had terrible experiences through the health system might already be super willing to distrust anything that is being told to them by institutions. And it's important to understand that really root, sometimes very real kernel of truth that anchors some of these theories. And that even it can be something a little bit more prosaic. For example, on the right-hand side, this is a screenshot of the website of the City of London Police. And they are putting out an appeal for information after a man pretended to be a health worker, went and gave an old lady a fake COVID-19 vaccine and charged her £160. In the UK, they aren't doing any home vaccinations. You have to go to a center and they're all free. So it's a national health service. But if you're an old lady and you trust things and you're not into the internet, so you haven't maybe seen the latest communications from the government, you might believe a nice man who says he's going to come and vaccinate you, and then he just takes your money and runs and injected you with a fake vaccine, right? So some of these concerns are anchored in truth, and that's an important part of how we have to approach this information. Now, if you have to talk about false information or a myth, it's important to do it in what we call the sandwich, the truth sandwich, which again comes from the debunking handbook that we were talking about. So start with the fact, always lead with what we know, warn that you're about to repeat the myth or the falsehood, explain why that particular piece of information isn't true or isn't accurate or is misleading, and then end with the fact again, reinforce it, right? Fact at the top, fact at the bottom, in the middle of your sandwich, you warn before you repeat the falsehood, and then you definitely explain why it's false. So we don't leave any of those causal gaps, right? And if you want a little bit more guidance on how to do this in terms of your images and the narratives that we use to write about coronavirus, we have a quick guide to responsible vaccine reporting on our website, and you can also access it through this link. So it's bit.ly/reporting vaccines. It's available as a 3-page downloadable PDF that you can keep or share with colleagues or print out and put in your home office. And it kind of walks you through some of the main things that we've seen today and how to apply them into any kind of work that you're doing, whether you work with words or with video or with images or planning social media strategy or editorial policy and overseeing kind of the governance of how you communicate as an institution or in your work. This guide is going to be super, super helpful.